Natalie, thanks so much for joining me today. I'm so excited about this interview with you. And before we get started, I just wanted to take a second to kind of introduce myself and then tell our audience a little bit about you and kind of why we're here today. So for anyone who doesn't know me, my name is Krista. I am a registered nurse and I am a huge advocate for genetic testing because of my own experience with it. My mom was diagnosed with breast cancer. Originally was only tested for the BRCA gene, the BRCA mutation, and she tested negative. Fast forward almost 12 years, and somebody suggested that she be retested, and this was shortly before she passed away. But we have since found that there are so many mutations that have been linked to cancer, which Natalie will tell us more about, that they thought she should be retested. So she did, and she found out she was the carrier of a mutation in her ATM gene, which is linked to breast cancer. Because of that, our family or her children had a 50% chance of inheriting that. Because of this, I chose to do my own genetic testing and found out I was also a carrier of this mutation. The specific variant that I carry is a 69% chance of breast cancer, as well as an increased risk of pancreatic and small risk of ovarian cancer. So it was recommended that I had more frequent and thorough screenings. And so for me, that meant doing a breast MRI once a year on top of my routine screening mammograms. And so I started doing those screenings. My MRI detected an abnormality that was not seen on my mammogram, and it has turned out to be early stage breast cancer. So that being said, I am a huge advocate for genetic testing. So we know that the earlier that cancer is caught, the more treatable it is, and the higher your chance of survival. So I truly believe that genetic testing has saved my life and can save so many lives. So I share this experience on my Instagram account. And because of this, I get a lot of questions about genetic testing. I met Natalie after I stumbled across her page on Instagram, Golden Genetics Health. And I immediately loved her because she has a similar passion for nutrigenomics and the effects that food and lifestyle have on our genes. Natalie is a board certified genetic counselor with a master's degree in genetics and genetic counseling, and established her company, which combines an integrative approach to genetic testing and nutrigenomics. Her hope there is to provide comprehensive and personalized care in the realm of genetic counseling and testing. So welcome, Natalie. I have such a great list of questions that people have submitted in hopes of getting some answers from you today. And I am so excited to hear what wisdom and insight you can offer to us about genetic testing and how people can benefit from doing their own testing in their life. So let's get started.
Awesome. I'm so excited. Thank you so much for having me.
One of the biggest questions I get probably once or twice a week is, who do I talk to about requesting genetic testing? Where do I start?
Yeah, so this is such a good question. First, obviously, I'm biased, so you can always reach out to me and send me a DM if you want my help. But also, what you can do is you can actually talk to your primary care physician or a provider that you see and ask if they have genetic counseling services at that location or at that hospital. And a lot of times there actually are genetic counseling services, just not a lot of people know about them. And you can always request that you get a referral to one of those genetic counselors. If the institution that you're at does not have genetic counselors, there's actually so many genetic counselors that now work virtually. You can also find a genetic counselor that may also take your insurance at findageneticcounselor.nsgc.org, which is our National Society of Genetic Counselors website. And I always recommend speaking with a genetic counselor before you do testing, because for a lot of different reasons, but you want to make sure that you're getting the appropriate genetic test order that you need for your specific family and health history. And then also there's just other considerations important for informed consent before the test is ordered.
And you said before, but also I would say after, don't you think too?
Totally.
Sure. A lot of people have said to me that they got their test and they don't feel like they need to meet with somebody because the test results that come from the lab will show like a risk analysis, right? Yeah. But I always like to share that my results actually came back and they were incorrect. And so my genetic counselor that I spoke with told me that it was actually higher than my lab results showed. And so it made a difference in my care and treatment moving forward. I think it's so important to meet afterwards also.
100%. I think so important to meet with a genetic counselor for like interpretation, because the specific plan that should be implemented for you may differ than someone else. There's also some, results that are complex. I think we'll talk about this a little later, but, inconclusive results that may be mistaken for a positive result. And so you just want to make sure you have a clear understanding of what the test is actually meaning for you.
Okay, so if they're requesting the test, is there a specific name? Like, what do you call the genetic testing if you're looking for cancer genes specifically?
There are different names associated with cancer genetic tests based on the different labs that offer them. Like mentioned earlier, a lot of these labs offer different panels. So that means that there are many genes associated with cancer that we've identified, and so you can test for a small amount or a big amount depending on your goals and what we see in your personal and family history. So I wouldn't recommend going and trying to do this test yourself. I think it would be really important, again, obviously biased, but to meet with a genetic counselor just to make sure you order the right test, because there are so many other genes. The largest panel that we use covers around 79 genes. So we can see, that's so many more genes than just BRCA1. But sometimes people just want to do a specialized panel for breast cancer, for instance. So we always talk about that and review that before ordering the test.
There are a lot out there too.
Yeah, there are a lot of direct to consumer, which means a lot of genetic testing labs that you can order just not through a healthcare provider on your own. And the labs aren't all created equal. So the technologies used are not the same throughout every lab, and that, also privacy concerns and the amount tested for varies across all different laboratories. So it's really important to also make sure that trustworthy lab is chosen. And so that's also another reason I don't normally recommend people doing those direct-to-consumer labs, because you wouldn't want a false positive or a false negative, and you also wouldn't want to be limited in the scope of what's tested for.
Great, thank you. Such good information. You did kind of touch on about how many genes we know of that are linked to cancer. But do you think at this point in time, it's possible that there are more genes that we do not know about?
Yes, 100%. Genetics research has just expanded so much, and we find out so many genes all the time linked to so many things, including cancer. So I normally recommend my patients consider doing update genetic testing every 10 years, just to make sure that there wasn't a gene recently identified that they carry and it wasn't in the original panel they did. But also, too, we actually are uncovering different ways to test for the genes that we've known about. There's this new type of testing called RNA testing, which is basically just another way to look at the gene and the function of the gene. And so even if someone was tested for BRCA1, I still would recommend update testing, because even if it was negative before, we could find something now. Usually, it takes a really long time for a gene to be put on a panel, because we have very stringent protocols to know. That's why I recommend usually every 10 years. But there's also other genes I've recently researched in nutrigenomics that can relate to oxidative stress or detoxification, which can be indirectly linked to cancer. So we can try to, encompass different ways of looking at the genes and different types of genes. Probably the best route we can go.
Love it. I think it's so fascinating, and think we just over the next 20 years think how far we're going to go with all this information that's evolving. So totally. Okay, thank you.
Yeah.
So the next question that was submitted is somebody who did not know their father's side, their medical history. How, in that situation, do you move forward in requesting genetic testing if you don't have a family history?
Yeah, that's a good question. I think, I would argue that it's almost more important to do genetic testing not more, but it's equally as important if you don't know family history. This person may be wondering if they can get a genetic test if they don't have family history. So in terms of pricing and insurance coverage, if you can't get the test covered by insurance because of lack of knowledge of family history, the out-of-pocket cost is usually around $250 for a cancer panel. So, I think I mentioned that just because I think a lot of people think it's thousands of dollars. And then in terms of the screening, so if someone has, like you mentioned before, Krista, if someone has an increased risk for breast cancer, we may recommend increased mammograms or breast MRIs. And if you actually have a mutation in a gene that increases your risk of breast cancer, insurance usually actually covers those screenings.
So what about people who had genetic testing, but it was negative? One of the questions that somebody submitted was, if I'm negative, does that mean that my sister would be negative also?
So no, if you have a family member who tests negative, that does not mean that you will test negative unless you are identical twins. The reason is because of inheritance pattern. There's 2 copies of each gene that we carry. We get 1 copy from our mom and 1 from our dad. So if your mom had a mutation in 1 copy, there's a 50-50% chance she passes on this copy or this copy. And then your father would pass on his working copy. So if your sister tested negative, it could be because your mom passed on her working copy and your dad passed on his working copy, but there's a chance that you inherited the non-working copy from your mom and it just didn't, and your sister just didn't inherit it. Most of these genes in cancer do follow something called a dominant inheritance pattern, which means that if one of your parents were carriers of a mutation, there's a 50-50 chance you do or don't inherit it. Which also means if your sister or your sibling was a carrier, there's a 50% chance you have it, but also the reverse. So we always just want to make sure that we test, even if you have a sibling who tests negative.
Thank you. That was a really good explanation. Really simplified. And I personally, in my family, I'm the oldest of 6 kids, and in my family, we've all tested now, and 2 of us are carriers and the other 4 were not. So
yeah, totally. And that shows, I think a lot of people think with the 50-50 too, that they equate that to if there's 4 siblings that 2 will have it, 2 won't, but it's not like that. It's just each pregnancy, there's a 50-50 chance. It's like a coin flip, each pregnancy.
Our next question that was submitted says, if I have a genetic mutation, what are the chances that my kids have it, and when should I consider getting them tested? I think that's one that a lot of parents have, especially I've thought of that so many times, like when do I get my kids tested?
Yeah.
And does it vary with different genes? I guess would be a good one to add too.
Yeah, good point. So again, with the inheritance pattern, most of these genes are dominant. So if you have it, there's a 50% chance that your children have it. Normally for cancer genes, we recommend children waiting until they're 18 to do testing. The reason is just because these genes have implications for adult life, and so just to maintain autonomy for the child, unless there is a gene that is associated with childhood cancers. So it really kind of depends on the gene there, but most of them are associated with adult onset cancers. And something I always like to think about too is, when is the screening what's the earliest age that screening is recommended for that specific mutation? And then that can also give you insight into, is it really necessary to test before that or not? So for example, BRCA1 carriers, we recommend clinical breast exams starting at 25 years old. So it may be beneficial, for that person to do testing before they're 25, just to see if they should start those, that screening at that age. But, sometimes screening is a little later. So obviously we want to consider nutrition and lifestyle, as that's a huge part of my practice. But in terms of screening and medications, sometimes it's okay to wait a little until your child feels ready for that information, because we wouldn't start that until later anyways. So I always talk about those 2 things with parents.
Awesome. Thank you so much. Our next question is somebody who has what's called a CHEK2 mutation. And they said, if I have done genetic testing and tested positive for this mutation, the CHEK2 mutation, do you think I should meet with a genetic counselor every so often? Why or why not? And you kind of touched on that, but if you wanted to answer that again.
Yeah, no, I think CHEK2 is an interesting gene. And so I would actually recommend meeting with a genetic counselor, especially for this gene, every so often, because we're actually learning a lot more about this gene, and recommendations have actually changed. Earlier guidelines had suggested different recommendations for the age to start breast and breast and colon cancer screenings, and also for the frequency of screenings. So it can be helpful to meet with a genetic counselor because obviously we keep up on that and those recommendations, so we can always help you. Also with Check2, because we're finding out so much, there's specific risk information for the specific mutation you carry in Check2. So like you mentioned with ATM, each different mutation in the genes can equal different risks for you and the different cancers. And so, genetic counselors can help you make sure you're staying up to date with that research and risk information for you personally.
You guys are such a good resource, and it is changing so much. You just think how much we're learning every day and how much of a difference it's making. I know something too for me personally is that with my mutation, a lot of people think you have a 20 to 40% risk. But my specific variant, I've talked to multiple genetic counselors who have said actually higher. So very interesting.
Exactly.
And so personal.
Totally. Exactly.
Okay.
Yeah.
Are there any, for all of our introverted friends, are there any reliable at-home genetic testing?
Yeah. So this is, I kind of mentioned this earlier. Again, little biased here, but I think, if you can even virtually meet with a genetic counselor first, that would be, the best way to go. Some genetic tests that I would not recommend using for this type of information would be ancestry tests. So, with 23andMe and Ancestry, I think, go for it if you want to learn where you're from. But be cautious when using that information for health data. Again, the technology used there is really different than what we use for medical grade testing.
So when, as a genetic counselor, you're looking at these results and giving people their individual risks, how much is their family history playing a role in?
The first thing that we want to keep in mind is this is actually, a big reason why you should do testing, because sometimes what happens is even if you have family history of a certain disease and let's say a parent carry a mutation that shows that they're at increased risk of cancer, there's a chance you actually didn't inherit that. So, some people come to me and they're like, I have so much family history, that means that I'm going to get it. So why would I do testing? Because sometimes we can actually find out that maybe you didn't inherit it. And this is actually really important for us to know regarding your risk of cancer. But the other thing to keep in mind is family history can play a really big role in other genes too. So for instance, if someone tests negative for cancer genetic mutations, there is other smaller genetic factors that may still be contributing to their risk. And so we actually do take into account family history when determining where you may fall on that risk. And we use a lot of risk models to try to help identify, where you may fall, because if there's a range in risk, like do you fall on the low or high end side, and family history plays a huge role in that. The other thing is that, if you grow up with your family, what I always like to keep in mind is that means that you were probably consuming the same type of diet. You were probably in a similar environment and having a similar lifestyle. So, that's kind of indirectly, but related to your family, how you grew up, the environment and lifestyle can really play a role in your risk too.
Definitely. I'm a believer in that for sure. Okay, so the next question is, I had genetic testing and my risk percentage is different. We kind of just talked about this, I guess, but it says my genetic testing and risk percentage is different than someone I know with the same mutation. Can you explain that?
Risk is something that is always hard to exactly define, but we do our best in genetics. We have risk models, and things that can change that risk are, again, lifestyle, environment, also age. There are certain ways we can incorporate those other smaller genetic factors. So one way that I like to do that is nutrigenomics testing. So I look to see how is your detox, oxidative stress, inflammation, and those type of pathways functioning for you. But there's also a new test called polygenic risk scoring, which is looking at those smaller genetic factors and seeing if those can affect your risk. So there's a lot of different tools and modeling programs we use, but that can give you different risk percentages, even though you both have the same mutation.
Great information. Thank you. I love that you offer that. That's really cool.
Yeah.
The next question came from somebody who said their mom passed away at age 41 from breast cancer, but never had any genetic testing. She had genetic testing and results showed positive for a PM and a TM. but said that the ATM variant was not significant. So she's wondering if you can educate her on the ATM gene and if there are ever instances when she might not be as high risk as someone else who's positive. So kind of in that same area you were just kind of touching on.
There's also something that with this question, the non-significant part is maybe referring to a specific finding that we have in genetics, which is called a variant of unknown significance, or VUS, we say, also sometimes called variant of uncertain significance. What this means is that the lab has identified a change in your ATM gene, but we don't have enough data or research right now in the genetics world to know if that change is actually harmful, meaning increasing risk of cancer, or if it's benign and it's basically just part of human diversity. The labs have very strict ways that they classify what we say results, and there's positive and there's negative, and then there's this kind of question mark in between. And we have so many different changes in all of our genes. And so realistically, we're still gathering research and data on what those changes mean. And with a variant of unknown significance, a lot of times, I would say 90% of the time, when we do get more research and data, those are downgraded to being benign. So most of the time, they're actually just part of human diversity and nothing to worry about. If you end up getting one of these results, for my practice specifically, I follow those patients who have a VUS result so that when the lab does reclassify it, meaning we have enough research to know which way it is, I always reach out to the patient and say, hey, your VUS has actually been downgraded. And so, with the ATM specifically, and you kind of touched on this too, but if that does go up to positive, there can be an increased risk for breast, ovarian, and pancreatic cancer. So, and it really depends on the type of change found. So I think, with that, I would just make sure to try to, whoever you saw for that testing, try to make sure that they'll update you when that reclassification happens.
That's really cool that you do that. I actually have not heard or met many genetic counselors that do that. I don't think any actually. That's really neat.
Yeah. I know. Yeah.
I have seen at the end of some lab reports, just from different people showing me there are sometimes databases that they will link at the bottom too that say you can input your information here and we'll send you an email. So
yeah, that's a good point. Yes, yeah. And there is, I will mention too, just in case someone or anyone watching this is having this issue, there's a website called ClinVar. We can probably put this in the caption, but you can actually research your specific gene and variant. It's very genetic language, so it can be hard to understand. But you can actually check your own variant through ClinVar, which is what we use as genetic counselors to see if it's changed from a VUS or not.
Very cool. Thank you for sharing.
Yeah.
Okay. One of our next questions says, as a genetic counselor, how much impact do you believe food plays in our individual risk? And does it matter if we're already at high risk? I love this one.
Yeah, this is such a good one. Such a good one. I would say too that this is a personal viewpoint, but with the research that I've done, I would argue that nutrition plays a huge role in our risk. And I'd also argue that if you are at high risk, that you should, that nutrition may even matter more for you.
And I think that that's growing as quickly as the field of genetics, right? All of these factors that play a role in how they're expressed. It's very, very intriguing to me.
Totally.
I also think I have a lot of people that feel like when I explain things like that to them, they feel like they're taking on the blame of a diagnosis. And even somebody who just received her own diagnosis in cancer, I can say, there's really no 100%, right? We know there's no 100% way to prevent cancer, but all of these little things can make a difference. And I truly believe that makes an impact. And so genes are not, I think nutrition and lifestyle is such a huge player in that area. So
totally. I think, that's such a good point you brought up. And yeah, exactly. Sometimes there are cases where cancer happens because of simply like bad luck, like our bodies make a mistake and a tumor can develop. Even if you're eating and living a perfect healthy lifestyle, that can happen. But, there's also a lot of cases where if you're not paying attention to those factors that contribute. I think, if we can view it as an empowered point of view instead of, feeling overwhelmed, it's more like, I have the ability to control what I can control and feel good about that. Let's take away the factors that can, be contributing negatively as much as we can there.
Yeah, I agree. I compare it a lot to a toolbox, and how, genetic testing is one type of tool that we have. Preventive surgeries can be another type of tool for if you choose that. And nutrition and lifestyle and environment, like all of these things are just tools that we're adding to our toolbox and can make a big difference, even if they can't take it away 100%, right?
Totally. Yeah, such a good point. The other thing I was going to say too that just came up for me too is, when we're thinking about genetics, there is research coming out about epigenetics, which is basically this study of how we can turn on and off certain genes. And there is a lot of research coming out that showing nutrition and diet can help us turn on our beneficial genes. So that's just like molecular science. Why it can be important is you're at high risk. We want to make sure those helpful genes are being turned on.
It is so empowering to me personally. And not everyone feels that way, I guess, but I love it. And I love being able to feel like I have some kind of control over some factors, right? So thank you so much.
Yeah.
Okay, if I had genetic testing and told I have no gene mutations, but have a risk of 39%, what are your thoughts about mastectomies and whether I should do it or not?
So first, I would want to make sure that you were tested for more than the BRCA genes, just because you want to make sure, again, like, Krista, you talked about with your mom, if you test negative, there's a chance maybe that something else could come up in a different gene. But the second is the way that we calculate breast cancer. There's a lot of different things that we incorporate into breast cancer risk specifically. I kind of mentioned this earlier, but we use different modeling. And so one of them is, the age you started your period at. Another is the density of your breast tissue. Again, family history, things like this. Age goes into those risk percentages. And so it kind of, I trust certain risk models over others. So I always like to ask to, what risk modeling system was used to spit out that number. But, regarding risk, reducing surgery, I definitely think, that's a personal choice. And you can definitely discuss this in more detail with your healthcare team on if that's something you want to look into based on, where your percentage came from and things like that.
Yeah. And I think even if it's something that you don't want to do, originally that was one thing that I did not want to do, is surgery. But I still think it's important to move forward and meet with the specialist and at least get all of your options. And like we said before, it's kind of like another tool in your toolbox, and that you have that knowledge. And then if it comes down to it at some point, like it did for me, right? I luckily had already taken steps to have that plan in place. And I'm so grateful now with this new diagnosis that I already had my surgery scheduled, and it was not something that I had to think about after diagnosis when you're just trying to process all of that. So still a good thing to do was meeting with those doctors and getting your options, even if you choose not to do it.
Exactly. Yeah, that's totally what I would recommend. Just, hearing different perspectives. And also sometimes the way you view that surgery changes over your life. So if you're young and you're not ready for that step now, that's okay. You can always revisit that option in the future.
Definitely. Okay. So what are your thoughts or suggestions about breast fibroadenomas? This person said they have not been able to find any help with them. Do you have any input from your perspective on moving forward with that?
Yeah, this is, a tough question, because I would say that I would recommend discussing these options with your healthcare provider. But if you're not getting help with any of that, you can reach out to me and I'll try to help you the best way I can.
Yeah. And I know a lot of times people just like to understand a little bit better about how genetics plays a role in those things. So I don't know if if it does or not. I'm not familiar with that either, but I think a lot of different things play into those too.
Yeah.
My personal opinion is, if your provider is not giving you answers or does not have answers for you, there are lots of others that probably could help more. So not every doctor treats things the same way, and so I call similar to job interviews. You don't always find the best candidate on your first interview, so you have to keep going. So if you're not getting answers, keep looking.
Yeah.
Keep looking.
No, I totally agree with that.
Okay, so one more question. And this person wants to know what your thoughts are on securing life insurance before genetic testing and if it can affect those costs.
Yeah, okay, so good question. I always like to give a little background about the protections we do have. So in 2008, a law was passed called GINA. It stands for Genetic Information Non-Discrimination Act. And this law does protect you against health insurance and employers from using your genetic information against you. However, life insurance, long-term care, and disability insurance has partial protection. This partial protection actually varies between states, so another reason to see, a genetic counselor to get details on that. But sometimes we do actually recommend securing a plan in, life insurance before testing so that, you avoid the risk of your results affecting cost or eligibility. You can always consult with a financial advisor or, an insurance expert too for personalized advice. The other thing to keep in mind with privacy and data, I think it's a big misconception that when you do genetic testing, your genes are with the government or they're being sold into all these different companies. And so I just like to mention too that when we do, medical grade testing for this type of genetic testing for cancer, the labs we choose specifically for my practice I'll speak on do not sell data to outside companies, including law enforcement. Everything's protected and private. Your sample is de-identified and destroyed, meaning your name is not on the sample and the sample it goes away after we get your results. So just like to mention those things too with privacy.
Thank you. It's good information. It was definitely something I didn't consider before I did my testing, but have since learned more about it. And so that's a great question. I'm glad people are starting to realize that. And a lot of people do like to secure their life insurance before they get the results. So I don't think it's a bad idea.
Totally.
So I think that was the last question. Thank you so much for taking time out of your busy schedule to meet and answer some of these questions and offer your insight and your wisdom. And I already have kind of expressed how I feel about genetic testing. And I think understanding some of this stuff more might help other people realize how beneficial it can be and how much of a difference it can make. And I just truly hope that everyone understands how, it can really save lives. So
totally. Yeah, and I'm so grateful. Yeah, so grateful for you, being open with your experience, because I obviously am passionate and feel the same way. I think people don't understand how it can really save lives, like you were saying. So if anyone has any questions or wants me to go into more detail about any of my answers, definitely feel free to reach out to me. And I would say, Krista, would you be open to receiving any messages from my followers? Perfect.
So where can we find you, Natalie? Where can they find you if they want to reach out to you?
Perfect. Yeah. So you can actually reach out to me directly via email if you'd like at natalie@goldengeneticshealth.com, or feel free to send me a direct message from my Instagram at goldengeneticshealth.
Thank you.
Yeah. Thank you so much.
Well, this was helpful for everybody, and that you got some of your questions answered. And if anything else comes up, don't hesitate to reach out to myself or Natalie.
Awesome.
Thank you.
Thank you.